Hi everybody, I'm Dr. Gavin Scriven. People call me Dr. Gav, and with me is the founder of the non-surgical penis augmentation procedure we call Caliber, Dr. Jason Oates.
Thanks, Dr. Gav, and together we are the Dick Doctors, and we are going to be talking about all things penis. Our area of expertise is injectable penis augmentation. There's a lot to talk about penises, and together, myself and Dr. Gavin will be doing that.
Hi everybody, it's Dr. Jason here, and I'm here with my fellow Dick Doctor, Dr. Gav. This is the Penis Show, reminding you that confidence changes everything. And today we're talking about scrotums, scrotox, scrotal enhancement, scrotal pain. Welcome, Dr. Gav.
Thank you. Good to see you, Dr. Jason, as always.
Good to see you too.
Yep, and looking forward to talking more about this scrotum today and this topic. It's an interesting topic, and there's definitely a lot to discuss, so we'll try and fit as much in as possible in a short period of time, I guess.
So have you ever come across that Saturday Night Live skit with talking about Scrotox?
No, I haven't, but I think now I desperately want to see it.
You want to see it? It's funny. Look,
Can we find the link?
Find a link for it, and we'll put it down below. But
okay.
You've got to see it. And look, when people first started talking about Scrotox, I thought it was a joke too. And it shows you how there's always more to learn. But why would somebody want to inject Botox, a muscle relaxing injection into their scrotum?
Well, that's a great question, Dr. Jason. Look, a number of reasons that I guess firstly, and for aesthetic reasons, there are guys out there who aesthetically think it's not as pleasing to have a very tight and wrinkly scrotum. It's simple as that. They believe that it would look much nicer if it was wrinkle-free and relaxed.
Yeah. Almost anything will make it look nicer, wouldn't it? It's almost like the archetypal insult to we say that you look like a scrotum.
So yeah, that would be one major reason, and you know, that's something that genuinely concerns some guys, and they are looking for genuine solutions. And of course, one of the main treatments would be using some kind of wrinkle relaxer, botulinum toxin, to relax the scrotum and give that smooth appearance.
A muscle relaxing injection. What muscle are we injecting if we're injecting into somebody's scrotum?
So for the purely aesthetic reason of the external part of the scrotum, it's a very superficial muscle surrounding the scrotum. It's the part of the dartos, I guess people refer to it as. And it's really, really quite superficial just under the skin. And it surrounds the scrotum, and it's what causes that tightening and wrinkling of the superficial skin itself.
Yeah. It's as you say, it's really sort of intimately bound to that deep surface of the skin, and it wrinkles it up. And it gives that significantly scrotal texture to the scrotum. That's and so right. When we're doing this treatment, it's relatively easy to tell where you need to inject and where not to inject, because you can see that wrinkling nature to it. And then exactly. As you come up closer where the scrotum is attaching to the lower abdomen, really, it goes smooth again, and you don't have that dartos muscle there.
Yeah. So
yes, you can inject it in there. You can put some numbing cream on first, because it's a lot of needles. Yes, it is possible to smooth it out somewhat. And of course, there are some guys who not only want the skin to be smoothed out, but they want it to hang lower as well.
So I'm not sure that might involve a different muscle, which is responsible for retracting the testicles themselves. As well as treating at the same time the dartos on the outside.
Yeah. So, look, this is where we should find another link to one of those videos of those kung fu masters, getting kicked in the groin, and not just keeling over, because the testicle is organ. So that means that it's come from inside your body, like in a woman, the ovary is an internal pelvic organ, and it's actually come to hang outside of the body because in the human, in fact, in sort of most mammals, that spermatogenesis, the creation of sperm, is better at a slightly lower temperature, like 35 degrees instead of 37 degrees, our core temperature.
Sure.
And that's why testicles sort of hang out in the breeze. And you wouldn't think that something so vital and vital for reproduction, you'd want to put out, you know, where the tiger's going to grab them or something.
No. So hence why they may have the ability from an evolutionary perspective to retract again very significantly.
Yeah. And, you know, and sometimes when a boy is born, you know, one of the things I actually check is have the testicles descended, and they grab them and give them a stretch. It's quite a strange thing watching when your son's having those first sort of natal sort of checks.
Yeah.
And then, yes, they can then also retract up. And if you're trained, you can learn to retract your testicles like right back up into your abdomen. It's also a reason why men tend to get more inguinal hernia in this region, because that tract of the testicle coming through the abdominal wall has created a weakening there. And so you're straining, you're lifting up something heavy, and you get a bulge of your intestine then following down into, and so that's why actually a full inguinal hernia can actually track all the way down into the scrotum itself.
Yeah.
So we've got this muscle that retracts, and so just like we can with the muscle relaxing injections elsewhere, so we can inject it into your frown and decrease your frown. We can inject it into this muscle, the cremaster muscle, and relax that and allow the testicles to hang lower.
Yeah.
My experience is that it's the guys who already tend to hang somewhat low. You relax their cremaster, and now they're hanging, swinging way low. And some guys really like that swing. You know, they like them to hang way down low. And in my experience, the guys who seem to naturally have very tight scrotums and the testicles held close into the body, even when you inject the cremaster, it's hard to get, you can't get the same hang and swing in a guy. I think that's been my experience. What about yourself?
Yes, definitely a similar experience. And it's strange having injected wrinkle relaxant to other areas of the body and seeing it work incredibly effectively. And in fact, there's no chance of being able to frown, for example, after wrinkle relaxer in the frown if you use the right dose. But in the case of the scrotum and the cremaster muscles, that it seems to be a different kind of muscle that has a reflex mechanism to it. It may get them to hang lower in certain situations, but they still have the ability to retract, which is not really the same in other areas of the body. But overall, they say when they're warm and they're relaxed, it's hanging lower. It is more relaxed, and it is a better feeling, especially if this has caused them some pain in the past. But in the really cold situations, or where they tend to retract more, they still have the ability to retract a little bit. So it's maybe a little bit disappointing that it's not always relaxed.
Yeah. Well, you mentioned something actually really important there, that scrotal pain, because sometimes we'll have guys who come to us purely for scrotal pain.
Exactly.
Usually they've seen their GP, usually they've seen a urologist, and that's definitely my preference, that they've seen a urologist and been checked out and found that there's nothing else that we need to be, worrying about. Because it is important, just like women do breast checks, men should do scrotal checks.
Especially if there's something causing them pain.
Yeah, yeah.
Or
when did you last do your testicular check, Dr. Gav?
I self-check on a regular basis, thanks to Dr. Jason. But no, definitely haven't been to see another doctor for an objective check of my scrotum.
I got to admit, I probably don't check my scrotum myself, but maybe I should make a commitment that I'll check my scrotum and because testicular lumps and bumps, testicular tumors are often actually treatable if they're, like a lot of these things, caught early. And unlike something that's I don't know, growing on your kidney or your liver, which you can't sort of get in and feel. You could feel this yourself on your own testicle. So yeah, so most guys wouldn't know this concept that you're supposed to check your own testicles, but that is a thing, and there are good health reasons for doing it. But okay, assuming that you've been checked out and there's no cause found for the pain, this what is often termed idiopathic pain. Idiopathic, it means that the doctors are an idiot and they can't find the cause of. Is that where the word comes from? I think that's the Greek root of the word idiopathic.
It does make sense, but yes, basically we can't find the cause.
We can't find the cause. So yeah, so in fact, most commonly we can't find the cause of this pain. So it's been attributed to a number of things, and sometimes it's put down to this tension. In fact, guys will often describe it as a tension, a tightness, a squeezing of their scrotum. And these guys do tend to have that very tight sort of scrotum. They don't come in usually with these dangly sort of testicles that other guys have. And so then it seems reasonable. And there have been a number of studies that have looked at injecting the botulinum toxins, the muscle relaxing injections, the same thing that we use, for frown lines and crow's feet, into both the dartos, that skin superficial muscle, and then deeper into the cremaster, and with only moderate success. However, if you're that guy who has the success with the treatment, well, then that's great. You've had a successful treatment. One of the difficulties, I think, with the treatment is the cremaster injection is that little bit deeper in, and the muscle, which also has the spermatic cords, so that bringing the semen from the testicles sort of around and then out to the penis eventually. There's actually this network of veins that go around it as well. And I think part of the reason might be that why the injections don't always work in the cremaster is that instead of having all the botulinum toxin, the relaxer stay in the muscle, that it might get into one of these veins and get wished off into the bloodstream and disappears and then doesn't have any effect anywhere. And maybe it's a dose thing. Part of the issue is that botulinum toxin injections are relatively expensive sort of procedures, especially when you can't guarantee 100% it's going to work. So we're using relatively big doses, but the question is then, should we be using bigger doses to get the effect? But I've certainly had a number of guys who have found it to be worthwhile. I'm thinking you were saying that you've had the same experience.
Yeah, definitely. Even if it's not 100% effective all the time, the relief, even if the relief is created 50% of the time compared to before they didn't have that relief, then that's still a big improvement. But it's interesting, and I've always found it very interesting that it has the ability still to retract after a high dose of botulinum toxin. So
maybe more in.
That's right. But no, certainly, and so it's a even though it's partially effective, it helps. Because it gives relief some of the time, which is better than before. Yeah.
And the difficulty that I guess these guys otherwise face is that, they've been to their GP, they've been to a urologist, and everybody's just, shrugged their shoulders and sort of said, don't know what it is.
Sure.
Tough.
Yeah.
At least the ability to be able to try something else and be able to get some level of relief, that is something good. And one of the other theories, of course, though, is that it's a vascular sort of pressure. And there have been a number of articles also talking about decreasing sort of vascular pressure in that area, but starting to get sort of really tricky. And again, it's not a surgery, I think, that's necessarily widely accepted or widely available. But just when I was doing research on it, I found there had been a number of publications. I just don't know anybody in Australia even who specifically does that kind of surgery.
Yeah. One other interesting thing I'll mention about this procedure is a number of patients who believe that it may be a side effect of some medications. Certainly, there are certain medications out there that may cause some type of contraction or risk, muscle.
Well, the one that springs to mind that a patient was telling me about was his ADHD medication, the stimulant.
I was going to mention that, exactly. Yeah. Same and I see there's a little bit of a trend there. I've seen a few with that same issue that believe that they get, they actually almost get pain from the tight contraction of the muscle, and having been on this medication for a long period of time.
Yeah, and the problem is they need that medication to function, and then, it's giving them pain, and it's another reason for them not to have have that sort of medication. Okay, well.
So what I guess other than that's something that we commonly treat and see. Guys ask some questions about the aesthetic concerns of the scrotum, relaxing the muscle, making it look smoother, and then the guys who have pain because of that contraction. But then you have some other people who may want to enhance the scrotum and make it larger.
Yes, okay. Wasn't sure we were going to get to that.
Sure.
So yes, there's obviously some guys having that big bulge in their pants is something that they like, and there have certainly been a number of things injected into scrotums over the years. And in fact, there's a kinky sort of thing about injecting even saline. So that's just water, sterile water, and stretching the scrotum up and getting some sort of fetish sort of enjoyment out of that. But no, we're talking more about longer term sort of augmentation of the scrotum.
Exactly.
Previously, guys have injected or had injected silicone. So that's a permanent filler into that area. And the amazing thing is that for the majority of them, it doesn't immediately get infected and drop off, which is what would worry the hell out of me. Guys, whatever you do, don't get silicone injected into you. And it may be good for a day, a week, 10 years, but it can go very wrong. So silicone, definitely not in favor of. But we can inject the similar sort of fillers that we inject for a caliber procedure, that hyaluronic acid gel filler. There are different kinds of fillers. There's firmer fillers and softer fillers. With the firmer fillers, the good thing is they tend to last longer. And when you're injecting that into the shaft of the penis to augment the penis, having a firmer filler that's going to last a long time is great. When you inject a really firm filler into the scrotum, it can actually feel like a third testicle, which is not necessarily the effect that the guy is going for, although it can then augment the volume. And also it takes a lot of volume to create that increase in size. You know, you put 10 mils into a scrotum and it like virtually disappears. So, 20 mils in and you're starting to get some noticeable increase in size. But yeah, it's an area that can swallow up a lot of products, so to speak.
Sure.
So yeah, I get the occasional guy who will come in and request this sort of thing. And I think for the majority of guys, it can be a cost sort of thing that perhaps prevents them from going ahead and making it a more common procedure. Because here in Australia, of course, fillers are just quite expensive. And when you're injecting 30 mils in, that becomes an expensive procedure. When you compare it to somebody having, say, 1 mil just injected in their lips, 30 mils in a scrotum, it's a lot.
You can imagine the cost blowing out quite significantly.
And then there have been surgical options as well. There are silicone sort of options, ones that actually sort of fit like a cup onto the testicle itself, and can add then increase in size. The downsides of that, and as we've already talked about, the whole reason why your testicles are on the outside is to have them at a lower temperature. And then you coat them with this insulating silicone that heats them up. And so that may reduce your viable sperm count. And, if you're wanting to produce children, then that's not an ideal thing. The other is that it also hides sort of half of the surface, 2/3 of the surface of the testicle. And if you were to get one of those testicular lumps, a tumor on your testicle, then you wouldn't be able to feel it.
And plus the idea of having, you know, a solid silicon cap on a testicle, which doesn't really appeal to me. Generally, I don't favor that as an option for scrotal enhancement.
Mm-hmm, mm-hmm. All right. Well, there's what's not to do, and things that can be quite dangerous, really, and especially mentioning at the very beginning there the silicon injections that can have fatal consequences. And I know I've seen a few programs on television about some really sad cases. So yes, there are some things out there that can be very dangerous, and you really should avoid doing that, especially in the non-medical setting. But there are things that we talked about today that can be done, and that we've had some results with. So if you have any more questions regarding the scrotum, then yeah, feel free to post and comment below, and we'll try our best to get back to you.
Great. Okay. Well, I look forward to talking to you again soon, Dr. Gadd.
You too, Dr. Jason. It's great to be here as always. And don't forget, guys, confidence changes everything.